Hello and happy Tuesday. Everyone's like, what the heck? This is normally a Member Monday Spotlight, which it is, but sometimes you have to work around certain people's schedules. And Dr. Chris Condon, yes, he's a male. I'm interviewing a gentleman today on our show because I am so thrilled that I had the opportunity to meet Dr. Condon. I wanted to bring him on this show to be able to give him the presence and the visibility because he is someone that needs to be seen and needs to be heard. And I'm extremely happy to have him on the show today. So, Dr. Chris Condon, welcome to the Member Spotlight today.
Thanks, Colleen. Thanks so much for having me. I know it's a little different than the normal protocol, so I appreciate the opportunity so much.
You know how much I love men. I'm married to them. I have sons. I have doctors that are men. It's all great. I discovered Dr. Chris Condon at a TV show that I was in Dallas, and we were both guests on this TV show. And Dr. Chris Condon told me how his chiropractic care, or corrective care, I should say, is so much different than some of the other chiropractors I've been to. And I had been dealing with some neck pain. And so I went through a whole protocol with Dr. Chris Condon. I feel, actually, I didn't even tell you this when we got on video, but I feel even better today. Like I feel better all the time, and I'm still, doing the protocols. But I think it was bringing awareness to understanding structurally what was going on in my body and understanding where the pain was coming from, why I had pain, how it was that we were going to fix it. And that's what you really specialize in, that I love so much. So I would love for you to share with our listeners, why do you do what you do? Like, Chris, when you graduated chiropractic school, like why did your practice look so different than so many others? What was it about you?
Well, I think that there's a lot of great chiropractors out there in the world doing great things, and a lot of us share a similar philosophy. I didn't realize at the time how blessed I was to go to the school that I went to and learn the philosophy and how critical that is to understanding who you are, which influences the way you do things when you get out into practice. So the philosophy that the body is a self-healing, self-regulating organism, that the brain and spinal cord is the master system and controller of that body, and any interference with that system must therefore cause the body a diminished ability to heal and regulate. So we come from a place of not just treating the symptoms, which almost sounds cliche these days, but the reality is that offering corrective care really is a different approach, in that we're very interested in the biomechanics, the normal structure function relationship of a healthy spine and the way that affects the nervous system. And one of the ways it affects the nervous system, certainly not the least of which, is causes pain, right? So people come in and they have symptoms. They don't say, "Hey, I feel terrific. Can you just keep me feeling like that?" Right? They have a pain complaint. So we get that, but we also want to educate people that there's a reason why. There's a cause, and oftentimes it's a deficiency. It's an abnormal structure relating to abnormal function, leading to compensations. Is it muscle? Is it joint? Is it nerve? Is it inflammation? And the answer is yes. It's all of that. And there's a reason why, right? There's a reason why. And when you were 10 and you were riding your bike and climbing trees and running around, you didn't have these issues because your spine hadn't yet been subjected to all those challenges that ultimately lead, for lack of a better word, to deformities. And so we help correct those, and we take before and after x-rays to show patients that. And it is a process. There's no quick fix, but it's a matter of understanding what is the cause and what can we do to change that and start pushing people in a better direction.
I'm glad you said the quick fix, because I want to ask those that are watching out there, do you all just go for the quick fix? Meaning, do you just go to the chiropractor, have him adjust you quickly, and then you get temporary relief, and then the pain comes back again, or something in your spine goes out, or whatever it is that's happening, and then you go to the chiropractor, you get a quick fix again, and then it's temporary solutions? And that was what I loved about the corrective care that you offer, is because it's about correcting the issues and the abnormalities that are in our body. So that structural matter of the spine, if it's off, it pulls muscles, it pinches nerves. There's so much in there that even my mind can't wrap myself around because I didn't go to medical school like you did. So, Chris, what are kind of would you say are um, the biggest realizations that your customers have during this process with you and the results that they're reaching?
Yeah, I think that what people quickly realize is that they didn't realize how much they had lost in terms of function. So things like people's ability to take long walks without pain, or hikes, or go to the gym and do the exercises that they want to do, or play with their grandchildren, or it could be any number of different normal activities that they hadn't yet recognized as a part of their problem, not just sort of the noticeable pain in any region of their body, but that it's actually affecting their functional ability. And sometimes that leads to issues that they didn't connect the dots, where they don't think of going to a chiropractor. But, we are primary care physicians by license, and our training mirrors very much traditional medical school. It's just that our philosophy is different. And so we really focus on the spine and its relationship to the nervous system and how that affects function in the body. And I always go back to that, because otherwise there are a lot of things that you can do to alter the way you feel. And, you might do some kind of variety of physical medicine or a modality. It could be a massage, it could be acupuncture, it could be dry needling, it could be it could be another chiropractic technique. And so we appreciate all of that, but we really take the approach of getting to the structural change that has to happen in order to not only make you feel good, but help restore function. Because if you take the stress off the body, it already knows what to do. People might say, well, I tried chiropractic, or I don't believe in it, or whatever. They might tell me all kinds of things and stories, but I said, it's okay. You don't have to believe in it. It works anyway. It's not a religion. You don't have to have faith. It's all good. There's such a thing as a normal spine, and everyone should have it from the time you're born till the time you die. And if we can just focus on that and really objectify it, I think that's what people's takeaway is they say, wow, no one has ever gone through the detail with me like you did. No one's ever explained it to me. No one's ever sat there and shown me my x-rays and measured the angles, and then take follow-up x-rays and show me the difference, so I understand my own body. And that's what we want. We want you to know how to help yourself.
Yeah, I think it's important. And the x-rays probably is what really set you apart for me to start, was that you were willing to look inside my body to see what was going on. And that's the reason why we do things like blood tests, right? Because if there's something going on in our body, we get our blood tested so we can understand what our levels are. That way we clearly can see what the issues are that we need to address. There's no difference when it comes to our spine. Our spine is huge when it comes to the function of our body. It's everything. It is your skeletal structure. So a headache, a backache, a stomach ache, numbness, like all the things you could possibly think of, lack of sleep, all of these things are coming from our structural being. And if we're not willing to give that extra care and we're just looking for the quick fixes, then, your corner chiropractor might be the one that you attend. But, you had was it back in Maryland that you had a practice and then you moved it out here to the West Coast? This is your third practice, right,
Yeah,
Chris?
yeah. It was actually,
Boston.
we had, just north of Boston. We were
Yeah.
there. We had a couple clinics, and the primary was called Andover Spine Center, and that was a tremendous success. And we were probably, one of the very most sort of prolific practices in the Northeast. And we were known for the technology and the techniques that we use that are so different. And I credit so many great chiropractors before me. Some of them were in Massachusetts that I got to train with, and that it actually invented protocols and techniques and equipment, and just had incredible research published that really paved the way for me. So I have to give credit to those people. And And then, yeah, then we just got, I think COVID accelerated our life plan, and instead of retiring out here, I just decided to start over. So I love what I do, and I love making an impact and making a difference, and I love people, and I love seeing potential realized. And so I know that's what you're all about. And I think that whether it's through something like what you do and that kind of coaching and direction, or if I can help coach and direct through the channels of chiropractic and how that applies to life and health and fitness and wellness,
Mm-hmm.
it's all good. It's all about making a difference in people's lives to see that they can live the life, sort of their best life, is really what it's about.
Yeah, it really is. And there is no need to be in pain. There's no need to have illnesses. There's no need for a lot of the things that so many people believe are caused from outside influences. There's so much we can control about our own being, our own lives, about our own health. And by watching this video, you're taking the number one step to educate yourself, to learn about how to take that first step. So I know you're located in Scottsdale, Arizona. I've put your website here, Ally Spine Center, for anyone to be able to go to your website. It's allyspinecenter.com. So you guys can go to the website. You can connect with them there. You can look them up on MapQuest or, Google Maps. Then you can call them and schedule. What does that process look like for someone that's in the Valley and says, I would really like to see if Dr. Chris Condon could solve my problem? Because that's what they have, right? Solve my problem. What's kind of the first step that they take, Chris?
So first step is just make the phone call, and Allie at the front desk, she'll answer the call, and she's my wife, and so she's looking out for you and looking out for giving you the best experience, and she wants you to feel welcome. So the best thing to do is just give us a call, and know that we're on your side. We're really your advocate for wellness. And then
Yeah.
you come in, we go through a careful consultation and history. We do a thorough examination, and then typically we'll take x-rays and or review any existing imaging that you might already have had. You can bring that in with you too, whether that's a CT scan or an MRI or plain film x-ray, whatever it might be. And then we give you our perspective, which is really the key, is our perspective on the problem, because there's a lot of different ways to approach these things, but we do teach you the difference between relief care and corrective care. And so we have all the different sort of modalities, if you will, and class 4 medical laser and spine med decompression. And we have definitely the most sophisticated equipment available to help you with a lot of these more complex conditions. So it just starts with a phone call and keeping an open mind.
Yeah, I totally agree. So if you know that you need to talk to someone like Dr. Chris and you are in the Arizona Valley, you don't even have to be in Scottsdale. I drove 40 minutes one way just to get to Dr. Condon's office. So wherever you are in the Valley in Arizona, and I have a lot of Arizona peeps that follow me on Facebook and on LinkedIn and on YouTube. If you're looking for a permanent fix for something that you have going on structurally, I really feel like you need to pick up the phone and give Chris a call. So, Chris, thank you so much for your belief in me. And thank you so much for joining me on this show so I could get the word out for you a little bit more about what you're doing so brilliantly in the Valley. So thank you. Really
Thank
appreciate
you,
it.
Colleen. I can't thank you enough. We're so grateful to know you and have your support, and I'm glad you're doing better too. So thanks for helping us spread the word.
Feeling great, and I'll continue to spread the word. All right, you guys, have a wonderful rest of your week, and come join us next Monday for our next Monday Member Spotlight.